Hello, my name is Reddy. I've always had an interest in nutrition, digestive disease, and the study of liver disease. I completed my undergraduate degree at Northwestern University where I majored in biomedical engineering. After completing my medical degree at St. George's University, my inclination was to lean towards a field where I had seen high technology being used towards treatment and diagnosis of disease. Specifically, in gastroenterology, we could see this in the form of endoscopy and in the form of various procedures that we use to help diagnose and treat disease. I completed my internal medicine training at the Medical College of Georgia. After this, I completed a one-year fellowship at Columbia Presbyterian University in New York, where I studied nutrition and gastroenterology. I completed my final stage of gastroenterology training back at the Medical College of Georgia, and I stayed on there as faculty for 2 years after completion. I currently live in Gainesville, and I am married to my wife, Dr. Nithya Reddy, and my children are Manideep Reddy, or Manny Reddy, who goes to Lakeview Academy, along with my daughter, Pavani Reddy, who goes to Lakeview Academy also. So, if you feel like you might have inflammatory bowel disease, I can tell you a little bit about it. There is, two major classifications, Crohn's and ulcerative colitis. The two diseases are very similar. Basically, they're a chronic inflammatory bowel disease. They've been there for a while. They're not something that just started last week. They're something that probably have had symptoms ongoing intermittently for a period of time. With these diseases, there's different treatments that we can offer. Some of the treatments will be more safe and are used for milder disease, but as disease gets more severe, it requires medications that changes the immune system and therefore carries some risks. And these treatments I'm sure you've heard about on TV. This include Remicade, Humira, Cimzia, and now the new product Entyvio. These medications are very potent and very effective. Because of some risks involved with therapy, people shouldn't be scared to use them, because overall, the risks of living with untreated disease and the quality of life impact are much more negative in the untreated patient than in somebody who's under good control. So if you are suffering with lower GI symptoms, including bleeding, diarrhea, abdominal pain, and if you haven't responded to traditional treatment for a disease that you were thought to have, such as irritable bowel syndrome, if you start to show warning signs and you're chasing down diagnoses of iron deficiency anemia or unexplained bleeding still, and you've never had a colonoscopy, please contact us at the Gastro Associates of Gainesville, or have your primary care doctor refer you to us, where we'll be able to assess you, determine the differential that might be involved, and then allow us to monitor you for the development of any potential complications of Crohn's or ulcerative colitis, including development of colorectal cancer.